issues, and future direction of the medical information policy. Hello, this is Chung Duk Kim, Deputy Director of Division of Informatization Management in Ministry of Health and Welfare. I'd like to explain the issues and future direction of the medical information policy of Korea. This lecture looks over how we developed medical information system using ICT, challenges which Korea is currently facing in medical information policy, and then the prospects for future technology development to find solutions. In addition, the lecture covers new issues occurred in healthcare and medical policy in the era of the digital transformation, and seeks for the direction of implementing major medical informatization policy. The course is comprised of overview of medical service informatization, challenges we face today, prospect for future technology development, new issues, and direction of implementing major medical information policies. Here are the course objectives. First, it is to build an understanding of the background or progress of the medical information system and challenges which Korea is facing these days, and look for alternatives, find out which issues arising from the era of digital transformation can be raised, and learn how the Korean government can overcome those challenges with new technologies. First, we'll look over how Korea started its medical service informatization. Informatization of healthcare or medical services is closely related to the changes in the healthcare system. Let's see it with two aspects as follows. In terms of service users, such as patients, there were four main reasons, like the demand for reduction in medical costs, increase in the quality of healthcare service, extension of patients' choices on healthcare service, and the demand for the protection of privacy, such as personal medical records. On the other hand, as for service providers like doctors, it needed for the reduction in medical errors, developing into an evidence-based medical technique, and improving the efficiency of medical care delivery. In other words, medical service informatization had been developed in order to improve convenience, safety, and efficiency in healthcare service delivery. If we take a look at the milestones by time period, the insurance claim program market was formed, and the National Healthcare Computer Network Plan and nationwide health insurance were carried out before the 1990s. In the 1990s, the basic plan for the National Welfare Network, including the Public Health Informatization Project, was carried out. In addition, the establishment and enforcement of the Health and Welfare Informatization Promotion Plan, implementation of Electronic Data Interchange System, EDI, enactment of the National Health Insurance Act, the implementation of Order Communication System, OCS, and Picture Archiving and Communication System, PACS, were carried out. The PACS was introduced more widely as compensation for medical charges were provided to hospitals that implemented the PACS. In the 2010s, the Emergency Department Information System was established and the Healthcare Accreditation System targeting domestic medical institutions was implemented. Furthermore, the Healthcare IT Integration Project was carried out, including the establishment of a Healthcare Information Cooperation System, improvement of the law, and the establishment of a medical records exchange model and standard. Under the supervision of the Ministry of Health and Welfare and the Korea Social Security Information Service, research for the establishment for a healthcare information foundation for matters such as the development and proliferation of a standard for healthcare terminologies was carried out. In addition, the government has plans for a pilot project of a healthcare big data platform and a national cancer big data platform. The outcomes of the informatization of healthcare data are vast. Although it's not possible to include all of them, we can take a look at the three major outcomes from a macroscopic perspective. The first is the improvement of healthcare quality, and it led to strengthening service consumers' rights, as well as a paradigm shift in healthcare from being treatment-centered to prevention and management-centered. Now, let's look at the challenges that the Korean healthcare system faces today. The biggest macro and environmental issues today are population aging. Korea is one of the fastest aging societies in the world, and this has increased medical expenditures. This is closely related to the decline of workforce populations. Older people over the age of 65 need more hospital care than younger people under the age of 65. Korea escaped from absolute poverty in the past, and thanks to this, the quality of life has become much better. But the development of medical technologies has led to the higher prevalence of chronic diseases. Unfortunately, however, the Korean people have made little investment in healthcare and disease prevention, and as a result, many chronic diseases that were once mild have often turned into serious or sometimes life-threatening conditions. As you know, medical expenses and social costs for these conditions are high. Now, let's talk about the inherent problems of the Korean healthcare system. The public's subjective health status is low, and the health gap among population, economic, and social class is wide. This leads to low quality of public health. Although efforts have been made to increase insurance coverage, the rate of health insurance coverage has stagnated, causing most people to buy private medical insurance. This has increased the burden on household medical spending. Not only that, there is a problem on information asymmetries, where some patients have less access to information than others. Also, functions of medical institutions have not been defined clearly based on its type. All this has led many patients to prefer large hospitals, causing medical resources to be concentrated to certain regions. This has posed a threat to the healthcare system that we must address. In addition, hospitalization rates for chronic diseases such as diabetes, hypertension, and asthma that need to be treated by primary care providers are higher than other OECD countries. Given this, it can be inferred that the quality of medical care for chronic diseases is low. Another problem is what we call medical commercialization, which is controversial today. Some try to pursue profits in medical institutions and the medical industry by saying that medical commercialization based on our excellent healthcare system can become a new growth engine. Others say the original purpose of medicine is to prevent and treat diseases, and this should not be neglected by the pursuit of profit. Then, what values should we pursue when we are faced with these challenges in our healthcare system? We should pursue public health and equity based on sustainability, quality excellence, and accessibility. Now, before discussing the future of health information policies, let's take a look at the prospects for future technology development. What kind of technologies will bring about changes in the healthcare sector? First, we can think of artificial intelligence. Companies like Lunit and Vino have already developed AI medical solutions to assist doctors in diagnosis. Based on digital health, patients can also manage their own health. And thanks to 3D printing technology, we can reconstruct high-resolution medical images into 3 dimensions. In addition, there are many new drugs such as cell therapy drugs, immunotherapy drugs, gene therapy drugs, and biomarker-based drugs. Then the question is, can these new technologies help us address the challenges that we face in the healthcare system today? If you ask me, it may or may not be possible, depending on what we do. Now, let me walk you through some of the new issues emerging in the healthcare sector. We expect changes in technologies, and medical services providers would bring about changes in the acceptability of medical providers. In addition, acceptability of consumers of medical care undergoes changes as well. Consumers of medical services are increasingly turning to accessible medical information. The introduction of new technologies in the healthcare system enables cost-effective medical services, but we need to consider whether this will be sustainable. Finally, there are persistent privacy issues about medical documents as well. For new issues, we need to strike a balance between public purposes and commercial purposes. When we talk about public interest, do we have a definition of it? I mean, what is public interest and what is not? Is there any scope for public interest research? Is public interest research always for the public? Can such research be both public and commercial? We need to think about these. Medical research is essentially human research, so I believe we should think about how to ensure the safety and dignity of humans and how to protect them. Healthcare issues raised with new technologies require public debate and consensus in this era of the Fourth Industrial Revolution. In that context, let me finish by introducing policies and projects promoted by the Ministry of Health and Welfare. Medical information policies are intended to create standardized medical information, integrate and link data, and use such information for the public and patients. This slide shows a project for healthcare big data for the public health. It connects the data of each person, including health insurance data from 4 public institutions, including NHIS, to provide such data for public interest research. The opening ceremony for the project was held on September 17th last year, and the government currently makes efforts to support various research projects. You can see the details in this slide. Next, the government plans to implement a project for medical data-centered hospitals to support medical big data research by a single medical institution. In addition, they also promote a PHIS project that builds a cloud-based EMR. Herein, PHIS means Post Precision Personal Hospital Information System, and EMR stands for Electronic Medical Record. The Medical Information Exchange Project is designed to encourage the exchange of medical information between medical institutions. The project aims to ensure that patients get continuous treatment and prevent duplicate examinations. In addition, the government currently plans a project called Smart Hospitals Development Project to allow hospitals with a certain amount of data to utilize ICT. I hope the aforementioned projects would help each player in our healthcare system exchange various information and provide more efficient, effective, and preventive care. And based on that, I hope Korean healthcare system will be more sustainable and effective, keeping up with these changing trends and demands. Thanks for listening.